Good evening and welcome to the National Parent Leadership Institute's webinar, The Effects of Adverse Childhood Experiences, What Parents Need to Know About Early Trauma. It's a parent-led webinar that addresses early childhood trauma, its effects, and what parents should know. So I bring you greetings from NPLI. I'm your moderator, Melvet Hill, and I'm bringing you greetings from our co-directors, Patty Keckison and Donna Thompson-Bennett, who are also parent leaders who graduated from PLTI. Thank you so much for joining the webinar tonight. Before we get started, I want to share with you a little bit about NPLI, or National Parent Leadership Training Institute. Our mission is to coordinate and increase the civic skills and impact of diverse parents to improve child and community outcomes as they build caring communities. What we do, we are developing the field of parent leadership by embracing a cross-race, cross-class, parent-informed, and pro-social learning approach to building parents as a constituency for community and recognizing children as the beneficiaries. And how do we do it? Well, NPLI works with agencies, community organizations, local and state governments, and other systems and trains parents, agency, and community leaders to view parents as valuable leaders and assets working to build caring communities. Let's say that again. To view parents as valuable leaders and assets working to build caring communities. So we have a great lineup of speakers tonight, and I wanted to take a moment to introduce a few of them before we get started. Our first speaker is Tanisha Cohen-King. Tanisha is a licensed clinical social worker and a graduate of PLTI class of 2012. She received her Master's of Social Work degree from Fordham University, a Bachelor of Science in Sociology from Southern Connecticut State University, and a Certificate in Behavioral Health from Housatonic Community College. Tanisha has worked in the human service field since 2000. She has experience working with survivors of domestic violence and sexual assault, individuals diagnosed with substance use disorders, and individuals diagnosed with severe, persistent mental illness. Tanisha is currently employed by St. Vincent's Behavioral Health Services, where she serves as Director of Clinical Services for the Community Residential Program. She believes in advocating on behalf of those in need, and also helping them to find their own voices and inner strength. She is a proud mother of 2 children, ages 7 and 18 months. Her motivation to keep helping to improve the quality of life for others comes from her children, her husband, and her higher power. Melanie Funches, who is a PLTI facilitator, activist, and mental health champion, is another speaker, presenter on our call. And she is currently employed by the Mental Health Association, where she serves as Director of Community Engagement in Rochester, New York. For 6 years in this position, she also served as the Key Family Contact and Community Director for Monroe County Systems of Care Initiative. In this position, she had the responsibility for integrating family and community voice into the system's transformation work at the practice, program, and policy levels. Melanie has served as an advocate for families and youth for many years and worked extensively in the areas of family engagement and empowerment, as well as community building. She presents, trains, and consults locally and nationally in the areas of mental health and communities of color, cultural competence, cultural responsive practice, family engagement, implicit bias, cultural brokering, community engagement, and partnership building, as well as racial trauma and healing. Melanie is involved in several national and community-based coalitions and organizations. Our other speaker this evening is Maureen O'Neill Davis. She is a Connecticut legislative advocate, Attachment and Trauma Network co-chair and founder. She lives in West Hartford, Connecticut, and she graduated from the PLTI class of 2014. Maureen is a public policy advocate, grant writer, and publicist. She leads Family Forward Advocacy Connecticut, that's FFACT, a grassroots group of attorneys, providers, parents, and community stakeholders focused on supporting family integrity through informing child-serving systems change, authentic identification of gaps in the state's continuum of care, and reforming child protective services culture, policy, and children with brain disorders or complex trauma history. She is also actively engaged in many groups and organizations, both locally and nationally, including the Connecticut Legislative Advocate for Attachment and Trauma Network, as well as the Connecticut Children's Behavioral Health Advisory Committee. And our final speaker will be Marina Schwegman, who's also a PLTI graduate. She is a mother of two. She is an advocate for children on the autism spectrum, and she's going to tell us a little bit about what she does and how she uses empathy to help others. So now we're going to get started with our webinar. I hope you're as excited as we are, and we're going to get started by talking about adverse childhood experiences, also known as ACEs. Adverse childhood experiences, or ACEs, are potentially traumatic events that can have negative, lasting effects on health and well-being. ACEs include verbal, physical, or sexual abuse, as well as family dysfunction. Adverse childhood experiences have been linked to risky health behaviors, chronic health conditions, low life potential, and early death. As the number of ACEs increases, so does the risk for these outcomes. So how did we arrive at the term ACE? The Adverse Childhood Experience Study, or ACE study, is a research study conducted by the American Health Maintenance Organization, Kaiser Permanente, and the Centers for Disease Control and Prevention. The original ACE study was conducted at Kaiser Permanente from 1995 to 1997. Over 17,000 Kaiser patients participated in routine health screening, volunteered to participate in this study. The family health history and health appraisal questionnaires were used to collect information on child abuse and neglect, household challenges, and other social behavioral factors in the original CDC Kaiser ACE study. Data resulting from their participation continues to be analyzed. It reveals staggering proof of health, social, and economic risks that result from childhood trauma. The CDC and Kaiser Permanente surveyed these 7,000 plan members to ask whether they had adverse childhood experiences defined as abuse, and under that would be psychological, physical, or sexual, neglect, emotional and physical, and then other household challenges, family members experiencing domestic abuse, mental illness, and imprisonment. At this time, I'm going to turn it over to Tanisha. Tanisha, can you share a little more with us?